Hi everyone, this is Jonathan here. I want to share with you a story, firstly about me and then widen it out a little bit. I do a martial art called Aikido, which involves often you move around on your knees and you do techniques and you're thrown. And I went to a 2-day it was a retreat where we all got together. It was very intense. And following that, when I woke up 2 days later, I could hardly move. I had this incredible pain in my left hip. And what I found was that if I stood on it, it wasn't too bad, but if I went to lift it, I would get this incredible stabbing pain in my leg. I couldn't remember specifically what I'd done to set it off, but it was absolute agony. Now, the advantage that I have is that I work as a pain specialist and I have a huge and abiding interest in trigger points. So what I did was I examined my own hip and I was looking specifically for a set of trigger points in the big muscles that are around my hip. In particular, a muscle called iliopsoas, which is a massive muscle often hidden away. And I lay down and I worked on my iliopsoas and I worked on my other muscles, the gluteal muscles and the rectus femoris and all these muscles that help lift my leg. And over about 2 to 3 days, initially it was agony, 10 out of 10 pain, and then gradually over a few days with regular work and stretches and heat and what's called ischemic pressure on these trigger points, by me, the pain melted away and now I have no pain. Now, this is great, and I'm very pleased that it happened to me and that I used the knowledge that I have to settle my own hip pain back, or settle my hip pain down. Just to put this in perspective, we had a discussion with a man from Denmark who had had pain in his hip, and but he hadn't had it for a few days. He had had it for 5 years. He'd gone to see every expert. He'd had all kinds of imaging, and he'd had different treatments done on it, and what he lived with was constant, terrible, unremitting pain in his hip, kept him awake at night, basically screwed his life up. He went onto my website, which is lifeafterpain.com, and he learnt about trigger points, and he applied the knowledge that was on the site to his own body. He treated himself, and what he said to us, he'd been treating himself for 5 days, and what he noticed is the same as me. He treated his own triggers, and over those 5 days his pain slowly decreased. It melted away after 5 years of constant and unremitting pain. He had contacted us to say a big, huge thank you, and for me, that's the best thing ever. Well, second best thing ever, the best thing was treating my own and making my horrible pain go away. But this just shows that, firstly, trigger points are really, really common. Secondly, treating trigger points is amazingly effective. And thirdly, even though they're really common, there are so many health professionals, especially experts, especially specialists, who really don't know about trigger points. It's really sad, but they don't. It's like a huge blank area. What they do is they focus on MRIs and other investigations, and they're looking for a whole other set of problems, which obviously affect a lot of people, but they miss this incredibly treatable and, when you know about it, obvious cause of hip pain. So I thought I'd share that with you because it's so fascinating, firstly from my perspective, and then how this man changed his own life by getting knowledge from Life After Pain, learning about those triggers, applying it, and poof, his pain melted away. Thank you very much.